Yeah, thanks to Brian for allowing us to film the base of 5th metatarsal 1 week check with an ultrasound. So this is a 1 week old fracture of the base of 5th metatarsal. I'm just talking to the camera. And how old would you be, Brian?
77.
77, yeah. So rolled it like an inversion injury, classic non-displaced base of 5th, not a Jones fracture, just a simple base of 5th. So a quick look at Brian's x-rays that we did a week ago. Base of 5th, if it's far enough back, you know, the fracture comes out proximal to the intermetatarsal joint, then it's not a Jones fracture. Simple base of 5th, undisplaced, see it on the lateral as well. I'm just going to check this position with our ultrasound today. And here in the fracture clinic, we like to check these after a week, make sure they're not displaced. That's the only reason for x-raying. It's not to look for healing, obviously, it's just to check the position. And you'll find you can do that with a scan just as well, actually even better than you can with an x-ray. So just put a bit of gel on, just go straight onto the spot, and you can see the fracture already. Just sort of scroll in a longitudinal fashion around where the fracture is, and we can see it's in a lovely position there. Very easy to see. We can expand it up a bit if we want to. There's the fracture there, and just looking at it from a few different angles, just rotating around. You often get a little shadowing underneath a fracture like that, even if it's not really displaced. And then rotating a bit further around to the front. Zoom back out again. So lovely position. No need to x-ray that. We can see that straight away. The position's fine, and we just wait for the 6 week or the 5 to 6 week healing x-ray, which saves Brian having to wait for another x-ray right now. And very easy for us to describe the injury to him and get him on his way.